These days, higher body mass index (BMI) has been associated with faster progression of early-stage autosomal dominant polycystic kidney disease (ADPKD) in short-term studies. Studies in animal models of ADPKD shows that food restriction slows its progression. These observations hint at the importance of dietary interventions to prevent or treat ADPKD. However, long-term effects of BMI and diet have not been studied. My name is Tatsuya Suabe. I am a nephrologist at Toranomon Hospital, Kajigaya, Japan. I conducted this study with Dr. Torres at Mayo Clinic, other Mayo Clinic investigators, and members of the Progressive Renal Disease Research Committee of the Ministry of Health, Labor and Welfare of Japan. The title of this article is Association between BMI and age at ESRD in patients with ADPKD in the United States and Japan. It will appear in an upcoming issue of Mayo Clinic Proceedings. Here we compared two populations with large differences in BMI and calorie intake. People in the US have the highest, while people in Japan have the lowest mean BMI among high-income and industrialized countries. This is the first large-scale study to evaluate the relationship between BMI and age at renal replacement therapy, RRT, in these two ADPKD populations. The study included 2,491 patients who initiated RRT from the US and 1,065 patients from Japan. The mean age at initiation of RRT was 56.6 years in the US and 61.6 years in Japan. The mean BMI at RRT initiation was 28.2 kg per square meter in the US and 22.0 kg per square meter in Japan. Japanese patients were 5 years older and had a BMI 6.2 kg per square meter lower compared to American patients with ADPKD. The BMI was significantly and inversely correlated with the age at initiation of RRT overall and in the US and Japanese cohorts separately. Univariate and multivariate analysis also shows that BMI was significantly correlated with the age at initiation of RRT overall and in the US and Japanese cohorts separately. It has been reported that the calorie consumption adjusted for body size is approximately 20% lower in Japanese compared to American population. Japanese people also consume much less sweets and soda beverages. Typical Japanese and American meals are quite different. The results of this study suggest that the lower BMI in Japan is likely associated with slower progression of ADPKD, and that the different dietary habits in Japanese and American populations may significantly affect the progression and long-term outcome of this disease. I invite you to read our article to learn more about this important topic.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.